Hi, my name is Emma. I am an LMSW. I use she, her pronouns. And right now I work in a clinic in Brooklyn doing mainly individual counseling, also some family and couples work. But previous to this, I have worked at Housing Works, as I was telling these folks, doing more case management stuff. I've run a lot of groups. I've done a lot of trauma-informed care work. I've been kind of all over the place, which is sort of common for social workers. Today we're going to talk about LGBTQ identities and some terminology and just ideas for how to do your best when working with folks whose identities fall in these spectrums. So mostly we're going to talk about LGBTQ identities, but I want to just start by talking a little bit about the nature of these sort of personal human identities in general. So everyone's identity is made up of a bunch of different components. And this workshop focuses on gender and sexuality, but those might not be the aspects of identity that are most important to our clients. We may have queer clients for whom it's much more important that they are a Christian, or an activist, or a rugby player, or a parent, or a sibling, or a person from a working class background, or a musician, or a Latinx person, or a person living with a disability. You know, you can't necessarily tell what's going to be most important. And what is most important is going to vary from person to person and over time for the same person. What is kind of tough is that each of these identities has an impact on how we move through the world and how the world views us. So a couple of my identities: I'm white, I'm a woman, I'm bisexual, I'm 33 years old, I have a master's. Just a couple of them, right? Not all of them. So some of the time, obviously, we can't escape how the world views us and our identities. They're visible, they're written on our bodies. Other times there are identities that we really wish the world could see, but they can't. So as you guys have maybe learned in MSW courses or have learned just through being a person in the world, some identities have a lot of power and privilege in this society. Others tend to be targets for oppression or marginalization. So for myself, I carry a lot of privilege related to being a white person, related to being a really highly educated person. I face some oppression related to being a woman and to being a person who identifies as bisexual. All of our clients are going to have this unique individual place in this really complex, nuanced matrix of privilege and oppression. And their LGBTQ identities, or lack thereof, are only going to be one small piece of that. Our job is not necessarily to know everything about our clients. We can never know everything about our clients. Our job is to be respectful and curious and willing to learn. So, what does LGBTQ stand for? Well, it's this big umbrella term that stands for two really different types of things. It stands for sexual orientations, that's the LGB part, and it stands for gender identity, that's that T part. So the L stands for lesbian, the G stands for gay, and the B stands for bisexual. These are all sexual orientations. The T stands for transgender, which is a description of gender identity. A transgender person could be gay, they could be straight, they could be bisexual, they could have some other sexual orientation. Those two things are not necessarily coupled. And the Q in here stands for queer, or sometimes questioning. So queer is another umbrella term that can mean a lot of different things to a lot of different people in relating to being a part of this gender and sexual minority subgroup. And questioning stands for people who don't know what words fit for them and maybe aren't going to find a word that fits for them very well. Maybe that journey is where they're going to stay. So we're going to talk about four sort of really important dimensions of LGBTQ identities, of sexual and gender identities. And we'll keep coming back to this slide to remember where we're at. The four we're going to talk about are biological sex and sexual orientation at the top, and then gender identity and gender expression at the bottom. So some things about sex, sexuality, some things about gender, gender identity. I've put these concepts into a particular order, one that I hope will make sense, will help it be easier to understand, but there's no one right way to talk about this. There's not a particular order they go in. This is not to say that sexual orientation is more important than gender identity. This is just one way of sort of assembling this really complex body of information. So, that being said, we're going to start at the top left with biological sex. Biological sex is a marker that infants are usually assigned at birth. So at birth, they're assigned a sex based generally on the appearance of their external anatomy, their genitals. That's what's written on the birth certificate. But biological sex is actually a much more complex set of physiological factors that includes chromosomes, hormones, internal and external reproductive organs, and secondary sex characteristics. Almost everybody falls into one of two categories. They're either male, sexually male. This is like your XY chromosomes and your external, you have penis, you have gonads, or female, XX chromosomes, internal vagina, ovaries, that whole set. That's most people, but it is not everyone. Some folks are intersex, or DSD is another term which stands for differences of sexual development. And those are terms that are used to describe people whose anatomy and reproductive organs or hormones and chromosomes do not clearly fit one of these categories. Maybe they have ambiguous genitalia or genitalia that appears male on the outside, but they have ovaries on the inside. Maybe their chromosomes are not XX or XY. They could be XXY or a different combination of sex chromosomes. And those chromosomal differences aren't visible on the outside. None of these really are visible on the outside if somebody's walking around with clothes on. Most people with DSD, with differences of sexual development, are assigned either male or female at birth, and they may have hormones or surgeries to help them align with whichever sex and gender they've been assigned. Sometimes this works well for them, sometimes it doesn't. Some intersex folks experience this as frustrating or oppressive or even coercive. But the reality is that male and female are opposite ends of a really complex spectrum, a continuum of different biological sexes. This is one where a vast majority of people are at one end of the spectrum or the other, but we shouldn't ignore the body of people who exist somewhere in the middle. Any questions at this point? Okay, a note about this. There are no bad questions. I know that in working with populations, when it comes to people, things that feel so personal, it can be really, really hard to ask questions, and that's why we have workshops like this, so that you can ask the questions that are scary or you're embarrassed about. So really, do not be ashamed. Okay, yeah?
Are parents allowed to choose to wait to have surgery?
I think they are, increasingly. This is not, you reach sort of the edge of my knowledge, but I think there was a time when doctors just made a call and moved for it, and I think that is less common now than it used to be. That's my guess. I think it's going to depend on your doctor, though. Okay, so now we're going to move across the top over to sexual orientation. Sexual orientation describes a person's physical, romantic, or emotional attraction to others. This attraction could be a really strong identifier for people, or it could be totally absent. Some folks just do not feel physical sexual attraction or romantic attraction, or they feel one or the other of those, but not both. Some folks may be attracted only to people of their own gender, only to people of a specific other gender, or to a whole variety of genders, the whole spectrum. As I mentioned, gender identity, not the same as romantic sexual attraction. So you can be transgender or gender nonconforming and be gay or straight. So for instance, if you had a person who transitioned from male to female and was attracted solely to men, that person would probably identify as a heterosexual woman. Okay. So we have some options here. We're going to move from left to right. Starting at left, we see a man who is shown here holding hands with another man. This, of course, could just mean that they are friends, but it doesn't. Holding hands in this slide is a signifier for these two people being in a romantic and sexual relationship. Okay? So here's our two men. The gentleman on the left, he could be cisgender, which is a term that means that your gender assigned at birth matches with your gender identity. He could be transgender. He could be gay or bisexual. Moving on to the middle couple, we have a woman with another woman. Again, either of them could be cisgender or transgender, gay or lesbian, or bisexual, right? And just a note, we've got a more masculine woman with a more feminine woman. That's not always the case with lesbian couples, sometimes, but we don't always have to recreate the binary. And then moving on, we have a female person, which you can tell from the hair, and a male person. Either of these people could be cisgender or transgender. Either of them could be heterosexual or bisexual. Make sense? Okay. Or something else. We'll get to some other things that people might identify as. So a few of the most common terms for sexual orientation that come up. Lesbian. Lesbian is an identity label for women who have primary sexual, romantic, emotional attractions to other women. Gay is an identity label most typically applied to men who have primary sexual or romantic relational ties to other men. Some women who are attracted primarily to other women identify as gay women rather than necessarily as lesbians. But it would be, I've never heard of a man primarily attracted to men who identifies as a lesbian. Not so far. Could happen. And bisexual is an identity label for people who are attracted to people of the same gender and other genders. That's the binary here, same and other, not necessarily men and women. Some folks use the word pansexual to get a little bit more distance from that gender binary and to sort of linguistically mark what they're saying is they're attracted to all genders. Okay. So one thing that I really want to point out as people who are out in the field working with people under this LGBTQ umbrella is there is a lot of daylight between identity and behavior. They're not necessarily the same. So if you are in a position where you are like taking sexual health histories or asking people about pregnancy or STI risk, it's really important to ask everyone about their sexual experiences regardless of what you know about their identity. One survey found that a large majority of lesbians, like by some estimates 91%, had had at least one sexual experience with men, and 8% in the past year. And then this graph up top is compiled from a number of different studies of sexual behavior versus sexual identity. And it shows that significant numbers of heterosexual identifying individuals have reported same-sex experiences, same-sex sexual experiences at some point in their life, and quite a number among both men and women just in the last 12 months. But now, we're going to hop on down to the bottom of our diagram. We're going to talk about gender, starting with gender identity. Gender identity refers to a person's subjective, internal experience of their gender. If your gender, your internal experience of your gender, matches the gender that is typically associated with the sex that the doctor guessed that you were at birth, you are probably cisgender. That's the word for cis here meaning same, right? If it doesn't, you are probably transgender. So transgender people are people whose internal gender identity does not match the sex they were assigned at birth. This does not necessarily mean that they identify as the opposite sex, right? For one thing, we've already talked about how biological sex exists on a spectrum. So does gender identity. So while most people have a gender identity that is man or woman or boy or girl, gender identity is better understood on a spectrum, with feeling sort of exclusively male on one end, exclusively female on the other end. So for a lot of people, their gender identity doesn't fit so neatly into one of those two boxes. Transgender isn't necessarily just box A to box B to box A. Sometimes it's like, I need both boxes. I don't understand your boxes. Because there are folks for whom their gender identity, it feels important that it encapsulates aspects of both masculinity and femininity. And there are other folks for whom this whole gender concept is confusing and alien and nowhere near as important as the fact that they really like math or want to play soccer. This gender of any sort just feels like not relevant to their human experience. When we're thinking about how often we're going to come across someone who is transgender, pretty often, it's a really hard population to get a read on how large it is, because a lot of people are not in social situations where they feel safe to share their gender identity. But a recent estimate has guessed that there's about 1.4 million transgender people living in the United States. And my guess is that's, if anything, low, because so many folks don't feel safe to come out. So that's a pretty big number. You are likely to see it. As with sexual orientation, this is not something you can tell just by looking, right? You're going to have to trust people about who and what they say that they are. So there may be a client or a patient who you meet who has really obvious facial hair, and she says that her name is Mary and her pronouns are she, her. Your job is to work with that, to challenge your assumptions, not to try and get your clients to fit your idea of what any particular gender should look like. So, given that we're going to talk a little bit about changing and differing constructs of gender identity. So an older construct and a really easy to understand construct is this notion of biology, right? Gender identity begins, sort of in the crotch area. Especially when we haven't had to struggle with our gender identity, this feels really right. Like, I have one set of genitals, most other people with the other set of genitals, they feel the other way, so it's a very gender-oriented situation, this gender thing. But as we've discussed, sex and gender exist on a spectrum. And like most other pieces of identity, I think gender lives in the head, in the mind, in the brain, as much as anywhere else, more than anywhere else. So our job is to let people tell us who they are, right? Just like our woman with facial hair that I talked about a minute ago. We just listen, right? And then when they tell us their name and they tell us their pronoun, our job is to do our best to use that pronoun, to catch ourselves when we screw up, and to advocate that other people use the name they want to use and the pronoun they want to use, and help other people learn to do well by them. It's also really important not to center a gender identity that doesn't apply to the person we're talking to, right? So an obvious one, and one that I don't suspect anyone would make this mistake, right? It's not okay to ask people what's in their pants, right? If you have a client who's transgender or whose gender you're confused about, it's no more okay to ask them about their genitals than it would be to ask a cisgender man about the length of his penis. It's just not relevant, right? And another one that is, I think, a little bit tougher, but also important, is no one needs to know that this person used to be or was born as a different gender, especially because chances are they didn't. Chances are they were always the gender they identify as. They just maybe didn't always have the words or the resources to let people know that. Okay? So we're going to talk a little bit about transition. Transition is a term that is used to talk about the processes that people undergo to change their gender expression and presentation to match their internal identity. This can include changing your clothing, your haircut, your name, your third-person pronoun, the hormones in your body, and it can mean undergoing a huge variety of different surgeries to try and get your physical form to fit better and be more congruent with your internal experience of who you are. It's important to know that gender identities are constantly evolving, and people can choose, can learn their identity, or choose to share their identity, or choose to begin transition at any point in their life. This is not one of those things where if you don't know at 2, it's not real. If you don't know in adolescence, it's not real. I've met some people who didn't feel safe to come out as their gender identity until their kids were out of the house. And that was when they started transition, in their 40s, 50s, 60s. It's also worth noting that not everyone is going to get surgeries for a couple of reasons. An important one is that the costs involved in those surgeries can be hundreds of thousands of dollars. And transgender folks are more likely than almost any section of the population to live in poverty. So a lot of times you just can't afford it. And even if you could afford it, not everyone wants it, right? Some folks, right, they're not box A to box B. There's not a surgery that's going to help them feel more like their gender identity. They just need to be as comfortable as they can in their skin. So not everyone is going to get a surgery, and that doesn't mean that changing their clothes or their pronouns isn't going to help them feel closer to the gender that they identify as, rather than the one that they were assigned at birth. So we're going to move on to our last square now, and this is gender expression. Gender expression is the external manifestation of gender expressed through a person's name, their pronoun, their clothing, their use of makeup or lack of makeup, their haircut, their body hair, their behavior, their voice, or body characteristics. The good news is this is one you can definitely see. It's all about what's on the outside. The bad news is you still can't necessarily make assumptions about what it means. Society identifies certain things as masculine and feminine, but what is considered masculine or feminine changes over time and between cultures. So we know some of these. I was sitting on the train coming down here looking at those Casper ads. You've seen them with the little like visual puns? And they were doing one with Nightmare that had a horse with a bow on its head. And that's how we knew it was a mare, a lady horse, because she was wearing a bow, which obviously only lady horses would wear. So that's an aspect of gender expression. I don't know any horses that are really picky about their gender expression, but I would be respectful if I met one. So transgender people typically seek to align their gender expression with their gender identity versus the one they were assigned at birth. But what it means to express a particular gender identity is always changing. Within the past century, it was seen as extremely masculine for a woman to ever wear pants, really like pushing the envelope. And in the century before that, pink was seen as a really hot, fiery color, very masculine. Blue, much more calm, soothing, more feminine. So if you were gender coding your baby, as we like to do today, you dress your little girl in blue rather than pink. So this is changing. It's changing over time, it's changing by society, but it also changes through person. And there's this spectrum, right? So people can express their gender in a very, very feminine way, in a very, very masculine way, or a huge variety of ways in between. And this is one where I think most people would put themselves somewhere in the middle. Most people would not say, I'm either the most feminine woman or the most manly man. They're somewhere in the middle of that. It's also worth noting that gender expression can change really quickly and really frequently. like as often as someone changes their clothes. You know, if I walked in here in a big poofy dress with a little tiara on, I would have a very different gender expression than the one I have today. Wouldn't be very comfortable for me. So I'm going to go over just a couple more terms that are a little bit more precise, a little bit more varied. You might come across them. There's a bunch more on that vocab sheet that you've got. It's yours to keep. So queer, I already mentioned. It's an umbrella term for sexual and gender minorities. Sort of anyone who's not gender, doesn't fit with the gender binary, or isn't heterosexual, or both. Two-spirit is a third gender term that's really common in Indigenous and First Nations cultures. It usually means that people feel that they have aspects of a masculine spirit and a feminine spirit residing in the same body. Some people feel like two-spirit can be applied to the whole LGBTQ community. Other people feel like it's really best for transgender folks. I, for one, would not use it because I am not an Indigenous or First Nations person, and I wouldn't feel that I knew how to do that in a really respectful, not appropriative way. But it's certainly one you may hear. MSM and WSW are terms that are behavior-based as opposed to identity-based. MSM means a man who has sex with men. WSW, a woman who has sex with women. That doesn't necessarily mean that they identify as gay or lesbian or bisexual. It's just about behavior. DSD, intersex, we already went over. This stands for people whose biological sex doesn't fit neatly into box A or box B, somewhere on that spectrum in between. Genderqueer or non-binary are terms for people whose gender identities don't fit into those binary categories of male or female. We talked about how it's not always box A to box B to box A. There's some people who are like, I need both boxes. I want none of your boxes. Genderqueer and non-binary are two terms for that. A related term is gender nonconforming. All of these terms are terms that we take, we don't give. You wouldn't meet a client and say, you are clearly non-binary. And they're like, whoa, am I? If they're confused, you might offer them the term. Say, does this feel like it fits? But it's not a label that you can just slap on somebody. Does that make sense? Okay. Pansexual, I talked about. Pansexual is a sexual orientation that refers to being attracted to people of all gender, regardless of gender, as opposed to, I think a lot of people feel like it just gets some space from the binary, as I mentioned. And asexual is a word for people who do not experience sexual or romantic attraction or experience it in very limited ways, very specific circumstances. And then we're going to go to this big acronym in the middle, right here. It's an expanded acronym. LGBT or LGBTQ are probably the acronyms you're going to hear most frequently to talk about this umbrella for these, as we're seeing, very different types of people. This expanded acronym just has a couple more identities that they're pulling in. So L for lesbian, G for gay, B for bisexual, T for transsexual, Q for queer or questioning, and then the I is for intersex. The first A is for asexual. The second A is for ally, for people who feel very strongly about supporting these folks. And the plus can either stand for all those other identities we couldn't possibly fit in, or for the HIV positive population, which has been historically really, really tied to gender and sexual minorities. So we have been through all of our 4 squares now, and we've come to the realization that all of these squares are not actually a single concept, but concepts that exist in a spectrum, right? And now we're going to look at those spectrums. So here they are. We've got biological sex from male to female, sexual orientation from attracted to women to attracted to men, gender expression from masculine to feminine, gender identity from man to woman, but it's kind of even more complicated than this. Because we've talked about, right, how for some people, sexual attraction is a strong piece of their identity. For other people, it's really not. They really don't experience it, right? And for some people, gender identity is, they want to be androgynous. For other people, they don't want any of this gender. Androgyny itself could mean, I want to really look in between, or I want to take a bunch of masculine stuff and a bunch of feminine stuff and have it all. I want lipstick and a suit. I want a ball gown and a tie and a top hat. I want all the gender, right? And those are really different concepts that are all just sort of stuck in the middle of these. So you may be asking yourself, Emma, why did you provide a slide of spectrums that you don't think encapsulate it? And one reason is that these slides were generously shared with me and I've adapted them, and I'm not a very good graphic designer, so I did not want to ruin it. But then I realized that while I am not a good artist, I can edit text, and I did. So here are some other sliders. They're on the back. So now we have a slider that just has your masculinity, right? And you can have none masculinity to lots of masculinity. We have a slider that just has your femininity, and we can have none femininity to lots of femininity. And it's not necessarily that if you're turning down your masculinity, you're turning up your femininity. Those are decoupled here. Likewise, we have how relevant is gender to me? From none, I don't care about this, I want to go play sports, leave me alone, to lots, this is really relevant, we have to talk about this or you will not know who I am. And then we have level of sexual/romantic attraction. Ideally, this would be 2 sliders, but again, not good at art, so I just left it at the 1. And that can go from no romantic and sexual attraction to some in certain circumstances to this is a really important piece of it. And people can be romantically attracted to certain people, but not sexually attracted to anyone, and vice versa. So it should be clear that these are constantly changing, right? Our ideas about gender and about sexuality are evolving really, really, really rapidly. When I first saw that last set of sliders, this set of sliders, many years ago, I was like, these are great. These are so nuanced. This captures so much. And it took years of thinking about it to be like, well, actually, I want more. This is not perfect. So, people change, we change, terminology changes. We're never going to get it right. We're never going to be perfect about it. It's just not possible. So what do? We screw up. And I want to have a note about screwing up, because you will. You will make a guess about somebody, make an assumption that doesn't prove to be true. I do this. I try and check myself, but I do it. And you will definitely, if you work with a lot of transgender folks, get a pronoun wrong. I do it. This is my bread and butter. This is my favorite thing to do and talk about, and I do it sometimes. Your job when you screw up, particularly with, say, a pronoun, is to say sorry, correct yourself, and move on. Keep working on it. Do not apologize so much that the person you just misgendered has to comfort you for having misgendered them, right? It's not on them to be like, no, it's fine, it's fine, it's fine, because maybe it hurt a little bit, right? So just say you're sorry, use the correct pronoun, and then keep going. And do your best. You're doing your best, and you can do better. We are all doing our best, and we can all do better. Doing your best means listening to your clients, taking the education that they give you, and going out and doing your own research, which, congrats, you're all doing, because that's what coming to a talk like this is. You're already doing your best. So I want to say thanks. It's the end of my didactic portion. As I said, I did not create most of these slides. I edited them. They were shared with me by the National LGBT Cancer Center Network, Cancer Network, that's what it is. They created these slides to help provide trainings like this, and they were really generous to let me use them and muck about with them and put them in the order that I thought was going to work best for me. So I want to say thanks. And then there's some references here. And now I really am open to questions. I don't know. I'm not someone, so the question is whether this word two-spirit, which is such a beautiful way of encapsulating this notion of having aspects of male and female within you, is one that can only be used by people of a cultural background that that term is native to. And that's not one I can give a firm answer to. I would say it's important to be respectful. It's important to know the history of the words we use and where they come from. That said, I would never want to say if this is the word that feels best for you, that fits best for you, you can't use it. I would just want people to know about what it is and the history and the cultures that go along with the words that they're using. It's a great question, thank you. Let me rephrase the question in case it wasn't heard. This is about gender identity and gender nonconformity in really young kids and how you advocate with schools and how you work with families. Say you had like a little 5-year-old person who is identified as a boy but wants to wear a dress, maybe wear a dress to school. So safety is a really important piece of this, right? And I think families worry a lot about safety, right? They think, this kid's gonna get bullied, this kid's gonna get hit. And they're not wrong. Like, there are a lot of risks to moving as a gender nonconforming person in the world. When it comes to little kids tend to get it pretty quick, actually. The older we get, the more firmly our ideas about gender get set in our head, just like our ideas about everything else. But little kids tend to be like, oh, it's Tommy. Tommy wears a dress. Great, let's go play ball. I see you. I will get there. But it can be tough. There's an organization called Gender Spectrum. It's a Bay Area organization I did some work with. They have great education for schools, and you can contact them, and they'll do advocacy at the school level. And in terms of parents, a lot of it is just talking about their process, separate from their kids, giving them a chance to voice their concerns and to mourn a loss, right? Because for them, there's a lot of expectations that we place on our kids, you know, when they're given that marker at birth. And so what may not feel like a loss for the person is just like, nah, I'm a little girl. I've always been a little girl. I don't know why you thought I was a boy. The parents or the family may still need to mourn the path they thought that child was going to take. That's just a very short answer. Gender Spectrum and also the Ackerman Institute's Gender and Family Project are doing great work in this area if you want some extra resources. Absolutely. So it was said that boys are, that little kids is sort of confirming in this person's work that little kids are pretty open and boys often want to wear the pretty sparkly thing. I mean, it's sort of just visually exciting, right? And little girls don't necessarily like, I get a chance. Yeah, that's a really good question. So the question is the population of ladyboy, do they belong under this LGBTQ identity? It's not an identity I'm very familiar with. I've certainly heard of it before. What I would say, ask the ladyboy in question, right? I would say they certainly identify. I can't say identify. They certainly, in my book, would count as gender nonconforming, right? We have ideas about what it means to be a boy. If you identify and present as a ladyboy, you're probably breaking some of those societal ideas. But that doesn't mean that you identify as transgender or as gay. You may just be a cisgender boy who likes to wear a dress sometimes. And those identities, what in American society is often called a cross-dresser, a transvestite, it's going to depend on the person whether they feel like they are absolutely under this umbrella or this umbrella has nothing to do with them. It's really individual. I'm really, really honored that you guys came. I'm really, really glad that you're putting in the time to learn about this stuff. I think it's really exciting. I think it's really fun. It can also be really daunting. On good days in this new society, gender is a wild playground where anybody can do anything and have all the fun they want. On bad days, it just feels like a big cloud of confusion. Thank you all. Thanks for coming.
Yeah.